Hello, my name is Lee Presser. This is my show. I speak frequently to very interesting people. Some of these conversations are so exciting, so intellectually stimulating, I thought others might like to listen in. This is the reason we started recording Conversation with Lee Presser.
Welcome to Conversation with Lee Presser. On March 21st, 2010, the United States House of Representatives voted 219 to 212 to accept the language of the health care reform bill passed on Christmas Eve by the U.S. Senate. 2 days later, President Obama signed the bill into law. Almost no one who voted yes or no on the health care bill fully knew what was in it. Months later, we're learning what some of the phrases and clauses in the bill will mean to those seeking medical services. To help us understand how this bill will affect your current health insurance plan is today's guest, Ken Schmidt, a health insurance broker who specializes in individual, senior, and small group health plans. Ken Schmidt, welcome to Conversation.
Thank you. Thanks for having me.
So you've had an opportunity, you were here not that many months ago, and in the interim you've had an opportunity to study what some of these phrases and clauses are going to mean to the people who are out there in television land watching this. And what they currently have health insurance. Before we went on the air, you were mentioning how there was about 250 million people who were covered and were happy with what they had. There was 30 to 50 million that did not, and for some reason the government thought that we need to change the whole system, the 250 million that were happy in order to include the 50 million that were not happy. And I found that a little puzzling myself, but that's what the objective seems to be. What all is this going to do to the 250 million that have health insurance now and are happy?
Well, first of all, Lee, it's maybe we should first say that it's called the Patient Protection and Affordable Health Care Act. PPACA is what everybody calls it.
What do they call it?
PPACA.
PPACA.
So, PPACA.
Oh,
so
another acronym.
Yes, another acronym that will confuse people. So. When the bill was actually ultimately done with the reconciliation package, it ended up ballooning to almost 2,700 pages.
Right.
And you talk about the time frame and what I've learned since we spoke last. It's going to take 200,000 pages, so probably a small forest, to implement this program because of all the intricacies that are involved in it. And it's also spread out over an extended period of time. It goes out to actually to 2018. I guess some things that I guess we can start with talking about what's going to happen first, and the way the law was.
Before you do that, let me just ask this quick question. Sure. Do you see any good coming out of this? I mean, you've studied this. Is there good in there?
I think there's some good in there.
Okay.
Okay, so I mean, to say that it's all bad, I think nobody would argue that some health care reform was not necessary. It's just, as you just indicated a minute ago, do you change the health insurance for 250 million people to accommodate 30 to 50 million people? That's what we've ended up doing if everything plays out the way Congress has set it up.
Okay, so you were saying that there's going to be a small forest full of trees cut down for all the pages of regulations that are going to be written by the executive department.
Right.
Okay. Go ahead.
Well, the first thing that's going to happen, and I think I get a lot of people saying, can we repeal this? What can happen? I mean, it's kind of interesting that still 65% of Americans are against this health care reform. I think the administration thought that, this would go away, everybody would be satisfied, but that's not what's happened. There's still 65% of Americans that say, we don't like this. Former
President Clinton actually said long before it passed that the passing moment would be the low point, and then as people learned what was in it, then the numbers would start to go positive.
And that hasn't happened. Actually, they've gotten worse. And I think that's exactly as President Clinton said, because people are finding out what it actually means. I think that some of the things that are going to, let me take a step back. People ask about the repealing of this, and only in a perfect world, if the elections changed and everything changed and now the Republicans held the Senate and everything else, is repeal even possible? But there's a lot of different dates with regards to implementation. So I think that, can implementation be changed? Well, I think that's going to be up to the next two elections, specifically the 2010 and the 2012 elections. Right. The things that are going to happen, some things are going to happen no matter what. You asked me before we started, some things going to happen? And the answer is absolutely, because they take effect as of September 23rd of this year. And when I say September 23rd, actually it's going to be on the renewal date. So for instance, if a small group renews on November 1st, it's not going to happen September, it's going to happen November 1st for them. Or next year, if their renewal is in June or January, that's when it'll take place. Some of the things that are going to happen are, and not in any specific order, so a child that's age 26 is going to be able to stay on their parents' plan. And they can stay on their parents' plan whether they're a student, whether they're a resident of Missouri or Illinois or wherever they're resident, the parents are resident, whether they're married, whether they have children, whether they're financially dependent on their parents. They can still stay on the plan.
That's interesting. So it's like a little group plan.
Well, yes, they anticipate that about 1.2 million, this is what the CBO or the administration has said, they expect about 1.2 million children, if you want to call them that, can stay on those plans, and about half of them, they suspect, were uninsured before. So, but they'll be able to stay on. Another thing that's going to occur is there's going to be a small business tax credit. I'm not...
You know, you just said something interesting there, and we'll talk about the credit in a second, but you said that many of them are not insured now, these kids, we call them kids, young adults who are older than 20, but not 27. That's the group we're talking about, right? And so, but they may not have insurance right now, but what I think I didn't hear you say was that they are now required to have this insurance. Is that correct?
Not required to, because the mandate's going to come a little bit later, but they're going to be eligible to stay on a parent's plan. So instead of having to fend for themselves, okay, or to find their own health insurance or go onto their own employer's plan.
So they are on insurance now?
And it's not that they couldn't get insurance. Okay. They'll be able to stay on their parents' plan. Now, one question that comes up with regards to that is that insurance companies may have to ultimately decide if they're going to raise costs with regards to that, because you're keeping people on longer than was anticipated. You expected, you know, somebody that's 26 years old to be working on their own program and not on their parents' plan. I think the fact that that you could be married, have a child, and still be covered under your parents' plan seems a little crazy to me, but that's just me. So
okay, go on.
Next thing that's going to occur this year, and I'm not convinced of how much impact it's going to have, but there's a small business credit, and it's going to start off anywhere from 35% of the premium that an employer pays up to 50%, and it changes over the next few years. I would suggest if someone's interested in that, or one barometer is that it's for groups under 25 lives. And the average salary has to be under $50,000. So the average salary of that group has to be under $50,000. If it's over $50,000, they're not eligible for the credit. If someone's interested in the credit, there's a calculator, and I don't normally refer people to the IRS websites, but the irs.gov website is a good website that has a calculator, and a small business person can find out whether they're eligible for it or not. Mm-hmm. Another thing that's going to happen in 2010, because this is all about 2010, 2011, 2012. In 2010, there's going to be a waiver of pre-existing conditions for people under 19 years old. And also preventative benefits are going to be covered at 100%. There's also going to be the plans, and when I say the plans, that means the insurance plans are going to be required to have a pretty sophisticated appeals process. I think the anticipation is there's going to be a lot of complaints about things that aren't covered, or hospitals have already said we're getting people coming in and saying we want this and we want that when the plans haven't even been implemented yet. So there's going to be a fairly sophisticated appeals process as part of it. Another thing that's going to play a part of it is, you've heard, and this was mentioned on the news, rescissions, meaning that people were canceled. I personally have never had someone canceled from their health insurance, but the only way that cancellations or rescissions are going to be able to be done going forward are going to be if it's a fraud, meaning someone committed fraud when they applied for the coverage, or a material misrepresentation of fact when they applied for it. Mm-hmm. Another thing for seniors, and this is already, I saw the administration touting this the other day, is that if a senior has a Medicare Part D prescription drug card, D as in Delta, there is what's called the donut hole. You've probably heard this before. That means when a senior's come out of pocket for $2,830 this year, okay, then there may or may not be coverage in their plan. Well, if you reach that donut hole, then the government's going to send you a check for $250. a one-time check for $250. The administration's already been touting that that's been happening. So, so those are the, the bill is a very complicated bill. Again, so many pages, so much implementation. But those are the, I think, the big things that are going to happen in 2010. In 2011. You've heard of health savings accounts.
Yes.
Okay, so there's going to be some impacts on health savings accounts, HRAs, and FSAs. In 2011, HSAs, if you pull money out for non-medical reasons, the penalty used to be 10%, now it's going to be 20%. Also, you used to be able to use your HSA, your health savings account, again, that's the consumer-driven type of health program, for over-the-counter drugs, and those won't be eligible anymore. So those are two things with regards to HSAs. Another thing that happens in 2011 is the CLASS Act, which is a long-term care plan that is being created within the health care plan, is going to be available to employers. Actually, it will be available to employees going down to 18. Now, I've been selling long-term care for a while, and it doesn't equate to me to sell it to an 18-year-old, but this will be available for people down to 18 years old. It is certainly another entitlement program. They've only estimated the cost of the premium at $240 a month, but if you're a student or if you receive subsidies, it could be as little as $5 a month. But there's not going to be any money put aside by the government for this. It's going to be strictly based on the premiums. There's a 5-year wait for the benefits. It's kind of interesting. I was in Washington earlier this year, and the actuaries that actually looked at this for the government said that this is not an actuarially sound thing. So this CLASS Act, this long-term care program, sets up another entitlement like Medicare or Medicaid that doesn't have the funding to take care of it in the long term.
So you're saying people are putting in $250 a month for a minimum of 60 months, and then they're going to be entitled to a long-term care program.
That's correct.
Which could last for many, many years and cost hundreds of thousands of dollars.
Absolutely.
Oh,
where does the money come from? Sounds like a good deal, but I sell long-term care, and people balk when they have to pay $240 for something a month. So I think the people that it will be most attractive to would be a student or someone who's already being subsidized with regards to the health care. The program, the CLASS Act, the long-term care program, is going to be an opt-in for employers. An meaning that the employer doesn't have to take it. Okay, it's going to be a program that's out there, and then the employees, if the employer opts in, the employee, if they don't want it deducted from their check, is going to have to opt out of it. So again, it's just a lot of more layers of complication with regards to what employers and employees have to do in order to participate in this healthcare reform.
Mm-hmm. Whatever happened to, like in Gunsmoke, when someone got shot and they went and saw Doc and they just paid him whatever it was to sew him back up, or pull the bullet out and then sew him up? I mean, are those days gone for good?
Well,
there's the question. At some point during the discussion of the healthcare bill, there was, no, even if you have cash of your own, you're not allowed to buy medical services. Did that make the final bill?
That you're entitled to medical services?
No, that you may not purchase with your own money, go to a doctor and say, I want this operation, not going through the whole government apparatus.
Well, right now, as I understand it, people can still go and pay cash. I mean, cash is still king with regards to anybody.
Well, they were going to make that illegal at one time.
Whether they want to do that is a different question. Another thing that's come up that happens in 2011 that I think that your viewers should be concerned of, or at least be aware of, is, and there's been a lot of controversy over this. In 2011, for the 2012 tax year, employers have to put how much health insurance premium, how much your health insurance premium is if you're an employee, how much it is, it has to be on the W-2s.